Good morning, sir. I'm Judy Isley and I am your student nurse for today. And today we will be doing an assessment of your belly or abdominal assessment. To start, I will ask you two questions. How old are you, sir?
I'm 19.
And do you have any problem in your stomach or belly?
No.
Do you have any cancer or ulcer in your stomach?
No.
Okay, that's good. So we will start the assessment, sir.
I am now inspecting his abdomen and looking at the contour, and I see that it is flat. I am now looking for the symmetry, and the abdomen is symmetrical bilaterally. No bulging masses or asymmetrical shape are noticed. The umbilicus is inverted and midline. I am now inspecting his skin color, and he has a brown skin tone. There is no sign of cyanosis, which would be blue pallor, and skin would be ashen pale color. No palpation are present, and hair distribution seems normal, and the demeanor of patient is normal, relaxed, and comfortable. I am now auscultating first because percussion and palpation can increase peristalsis. If you hear a bloat during auscultation, you want to skip the other two. I will begin listening in the RLQ at the ileocecal valve. I will listen for 5 to 30 vowel sound per quadrant to hear if there are normal or hyperactive sounding. If no sound seem present, listen for 5 minutes to be absolutely sure. Using the bell of the stethoscope, I will now listen to the vascular sound over the aorta, renal, and iliac arteries. For the OST, I will not listen for the femoral artery. I heard no growths present. I will now percuss the map out the liver border, beginning in the area of lung resonance and go down the intercostal spaces until the sound becomes dull. I will mark a spot on the patient's body around the 5th intercostal space and then find abdominal tympani and place another mark where it changes back to the dull sound. I will measure the distance between the points, and a normal liver span range in adult is 6 to 12 cm. I am now doing the blunt percussion on the liver, and no tenderness is present. I am now performing the light palpation to identify areas of tenderness and muscular resistance. Using the finger, begin palpation in the non-tender quadrant in a dipping motion. Then gently lift the fingers and move to the next area. The abdomen is non-tender and soft. There is no guarding. And now, deeply palpate all the quadrants to delineate abdominal organs and detect subtital masses. Using the palmar surface of the fingers, compress to the maximum depth 5 to 6 centimeters. And now palpating for masses and noting their location, size, shape, consistency, palpation, tenderness, and mobility. Palpate the umbilicus and surrounding areas for swelling, bulging, or masses. In palpating the liver, stand at the right side and place your left hand under the client's back at the level of the 11th and 12th rib. Lay your right hand parallel to the right costal margins. Ask the client to inhale, then compress downward and inward with your fingers. The liver is not palpable, and it is firm, smooth, and even. In palpating the spleen, stand at the client's right side, reach over the abdomen with the left arm, and place your hand under the posterior lower ribs. Pull up gently and place your right hand below the left costal margin with the fingers pointing toward the client's head. Ask the client to inhale and press inward and upward as you provide support with your other hand. And as I palpate the spleen, it is seldom palpable in the left costal margins.